Hey y'all, welcome back to the Nursing Chronicles with Monique. I am Monique. Thank you so much for joining me. Please remember to like and subscribe. Hit that little bell so anytime I upload, you will be notified. And help a sister out. Help me get to 1,000 subscribers before the end of 2019. My nurses out there, come on y'all. Help a sister, a fellow nurse, get to 1,000 subscribers. Thank you everyone for joining me today. I want to talk about this particular upload. You know, I'm always giving you guys the tea as to what's going on in these nursing healthcare streets. Nobody else is bringing it to you and telling you guys the truth about what's really going on. So I'm going to spill the tea today. And happy Tuesday to you. So let's talk about Alabama system pays hackers after ransomware attack at 3 of their hospitals. So 3 hospitals were hit with a ransomware attack in Alabama. And how about they had to pay the hackers? I thought you never paid, you know, I thought, the saying was you never pay a kidnapper ransom, but I guess in this case they had to. So let me read this to you. Tuscaloosa, Alabama, DCH Health System announced on October 5th that it had paid hackers an undisclosed ransom to restore access to locked systems at its 3 hospitals. This is the quote. We worked with law enforcement and IT security experts to assess all options in executing a solution we felt was in the best interest of our patients and in alignment with our health system's mission. Spokesperson Brad Fisher told the Tuscaloosa News. This included purchasing a decryption key from the attackers to expedite system recovery and help ensure patient safety. For ongoing security reasons, we will be keeping confidential specific details about the investigation and our coordination with the attacker. Wow, this is crazy, guys. I know they used to always talk about stuff like this, but in this day and age with all these electronic medical records, I guess people are just sitting at home and their job is to just commit these crimes via the internet. So it says DCH Health System have been diverting patients at its 3 hospitals, DCH Regional Medical Center, Northport Medical Center, and Fayette Medical Center since October 2nd due to ransomware attacks. While the hospitals have been able to continue to treat patients, it's unclear when they will be able to begin to admit new ones. Since paying the ransom, DCH Health System has completed a test decryption and is restoring its systems. The health system has thousands of computer devices within its networks, so it is unclear when this process will be completed. Wow. So they just basically shut these hospitals down, yo. These patients, they had patients in-house, but they could not admit more patients. And they had to actually purchase the decryption information from the hackers. So the hackers won. This is nuts, people. So it basically, you know what? Basically, you need to have a copy of your own medical records at your house in your custody. And so if you have to be admitted to a hospital, you can bring your paper copy and give it to the doctors just in case something like this is going on, because they literally had to divert patients to other hospitals. They couldn't admit them. And then they had to purchase the encryption, the solution to getting back into their systems. And we're not just talking probably about the electronic medical records. You're talking about those scanners, the cows, those carts on wheels. People do, blood testing, some of the blood glucose, all of the stuff that everything is electronic and gets uploaded. So you're probably talking about everything. And that's why even with the advent of computers, we still need to have a paper way to do things. How we used to do stuff on paper and write out our notes, we still need to be able to do that. But yes, this hospital system had to pay the hackers, honey. And this is dated October 7th. So this is something we all need to keep our own medical records, at least a basis of our medical records at home. That's what that teaches me. So let me give you guys some more tea. Virginia physician gets 40 years for leading opioid drug ring. Lord have mercy. Some of our family members just can't do right. It says here, a Virginia physician was sentenced October 2nd to 40 years in prison for illegally prescribing opioids and leading an interstate opioid drug distribution ring. Lord. Joel Smithers, MD, was convicted in May of 861 federal drug charges, including illegally prescribing opioids and maintaining a place for the purpose of illegally distributing controlled substances. Lord, Lord, Lord. Prosecutors said Dr. Smithers prescribed 500,000 doses of opioids over a 2-year period. Wait, let me just stop right here. 500,000 doses in a 2-year period of time. But my question is, how could you prescribe this when these people are filling these prescriptions at the pharmacist and you keep seeing this doctor's name, Dr. Joel Smithers, Dr. Joel Smithers? After your 100,000th time in that year, wouldn't somebody have said something or called somebody? Somebody make this make sense. In the words of Monique the comedian, somebody please make this make sense, because this don't make no sense. But anyway, I digress. Jurors found Dr. Smithers guilty of prescribing the drugs that caused the death of a woman in West Virginia. He faced up to life in prison. I just hope that this sentence will set an example of what happens to doctors who abuse their authority in prescribing medications for profit. This is a sensitive subject because there are many people who have lost family members in their lives to drug addiction, and then with this opioid epidemic to overdoses. And, we should never abuse our power and our authority as healthcare professionals, be it doctors, nurses, whomever you are, because people look to us to assist them and help them. But he clearly violated his oath. He did harm, and he has 861 federal drug charges against him. But he was just, willy-nilly with writing those prescriptions. And it's like, what are you thinking, dude? Like, you didn't think you were going to get caught? But after like the first 100,000 prescriptions in that first year, okay, so say if he did 250,000 one year, 250,000 next year. After 50 to 100,000 prescriptions in that area, and I'm not sure if he just did it in that area or, but, why didn't somebody say something? I mean, when you see this man's name constantly, on a prescription, and you're filling prescriptions for all of his patients, but those are stories for other days. It could be fear of your job, whatever have you, but this is really sad, and I'm glad he's not able to abuse his position any longer. So on other news as it relates to healthcare, now I'm always on this bandwagon about starting your own business, why you should do that, transitioning from the hospital. Guys, things are changing. I don't know if y'all know. Ain't nobody else telling y'all this. I know some hospitals, they're building all these big, pretty cancer units and stuff like that, but hospitals throughout the U.S. are closing like crazy. I don't know if people telling you, but let me let y'all know. Okay, fam, Oklahoma Hospital lays off most employees, partially shuts down. Okay? Haskell County Community Hospital in Stigler, Oklahoma, laid off most of its staff September 2nd. The emergency room is the only part of the hospital that remains open, according to TV station KJRH. Haskell County Community Hospital is one of several hospitals previously owned by Kansas City, Missouri-based Empower HMS that filed for bankruptcy protection earlier this year. Another hospital took over and tried to control the expenses during the bankruptcy process by closing most of the facility. And basically, they're hoping that the hospital comes out of bankruptcy, but the staff was 70% to 75% of the hospital staff was laid off September 2nd. And she said this person was saying that all the patients were transferred to other facilities. So, yeah, this is happening. Okay, this is happening. Little facilities are closing. I wonder, just like we only have, 5, telephone companies for cell phone service. I wonder if it's going to get to be like that as it relates to healthcare. But my warning to you is this is happening. Medicare is not reimbursing what they used to. These little hospitals can't compete with these big ones. And so, Nurses are losing their job too. Ain't nobody talking about it, but I just saw something about United Healthcare laying off about 10,000 workers. But then that's real strange to me because I remember at the beginning of the year, they were saying something about how United Healthcare stock was doing so wonderful. So, it's not making much sense to me. Somebody help me make sense of this whole situation. How you doing so good and so well, but then you got to lay off 10,000 people? So somebody help that make sense because it ain't making sense to me. But what I'm trying to say to you guys is keep your eyes open. Stay tuned. I'm going to bring you the information to hopefully help you make sense of what's going on, but also to help you make some decisions if you kind of stuck and really haven't moved to action, because the best thing to do is to move to action, to do something if you are in that process or in that thought process in your mind about, you know what, I want to transition out of nursing. I want to start my own business. I need to build my business credit. I need to do something because this ain't working. That's why I'm bringing you the news, because I would read this stuff every day and I'm like, is anybody else telling the nurses out there what's really going on in these hospital streets? They ain't saying nothing. All right, so let me tell you, look, and I can't make this up. I really can't make this up. When I saw this, I was like, seriously, is this what's going on? DC hospital goes 11 days without running water. When I told my son that, he was like, okay, I've heard everything. All right. Washington, D.C. based St. Elizabeth Hospital has gone 11 days without running water after leaders discovered the presence of Pseudomonas and Legionella bacteria September 26 during routine testing, according to WTOP. The state-funded psychiatric facility, which is replacing all faucets and chlorinating water lines, should have portable water by October 11th, Wayne Turnage, deputy mayor of the district's HHC department, told WTOP. Patients and staff are currently using bottled water, hand sanitizers, and portable showers. As of October 4, none of the facility's 273 patients have symptoms of Legionnaire's disease. The hospital continues to accept patients. Okay, are y'all serious? So, okay, no running water. Y'all still got patients there. Nurses are still there who have families at home. So if the nurses get sick, the family members can get sick, and they continue to accept patients. And you don't see something wrong with this picture. They kept all the patients there, giving them bottled water, hand sanitizers, and portable showers. You know what? This is what things are coming to, guys. And I'm not making this stuff up. This is all what's going on, because to me, that's just not acceptable. Not for the patients, and especially not for the staff. I'm happy that no one else has come down with these Legionnaire's symptoms, but seriously, people. Okay, and on to other news. Strike threat looms at a Chicago Mount Sinai Hospital rehab hospital. Workers at Chicago-based Mount Sinai Hospital have voted to empower their bargaining team to call a strike if they are unable to reach an agreement with hospital management, according to the union that represents them. Service Employees International Union Healthcare said October 2nd that a strike would affect 400 certified nursing assistants, housekeepers, dietary workers, and others at Mount Sinai and Schwab Rehabilitation Hospital. Both hospitals are part of Chicago-based Sinai Health System. The union said the workers seek to ensure that they can provide quality care to people they serve on the city's south and west sides. And so what they're fighting for, what we always talk about, it says here, as the hospital industry focuses on the bottom line, most of the workers providing patient care and keeping the hospitals clean and safe are struggling to pay their own bills, afford their own health care, and contribute to their communities, said the SEIU healthcare rep. Understaffing is putting patients at risk. All of these practices are widening the racial disparities that already exist in the city. So guys, look, I'm not saying this just to be saying it. The south side of Chicago is not the nicest side of Chicago. I'm not from Chi-Town, but most south sides of most major inner cities are not the nicest side. So you got some of the most vulnerable patients, the poorest patients, and you got the people who are taking care of them are basically saying we're struggling to keep our bills paid. And we're struggling to pay for our own health care. And we need more help. And this is typically what is the situation. These are not nurses, but these are our ancillary staff. Shout out to my CNAs, because the CNAs were the ones who taught me what I know in nursing when I first got in. I went to school and we made them occupied beds with the daggone mannequins, but the CNAs taught me how to make an occupied bed. The CNAs taught me how to draw blood. The CNAs really taught me how to take a blood pressure. Those were the CNAs, okay? Because they have the bedside experience. So these are some of the crucial staff that's needed, and they're threatening to go on strike for basic things, just for stuff such as the staffing, their pay, maybe getting a raise, every once in a while, that type of thing, and just things being fair. And I see that this is just not something that's going on. And that's why I encourage nurses, don't just wake up, nurses. Okay? I got a wake up call the hard way by having a health crisis and realizing don't nobody care nothing about you. Okay? Shout out to one of the nurses I spoke to yesterday and telling me about her goals as far as it relates to her transitioning. Shout out to you. You know who you are. Thank you so much for consulting with me. I certainly appreciate it, and I hope that we can form a partnership and we can do some things so 2020 can be a better year for all of us. Because nurses, look at it this way: we are a valuable asset that is undervalued. We have a thankless daggone job, and nobody is really out there really rooting for us. No, who has our back? Really, besides some of our family members. Who out there in those hospital healthcare streets really has our back? Sit back and ask yourself that question. And then you sit there and be like, num, 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 num. Nobody. Nobody don't got your back. If you gotta go out sick or something happens, you might have a couple of nurse friends who, you have a relationship with. But for the most part, this is a business, people. And I had to understand that and get that through my skull the hard way. This is the business. Don't nobody really care nothing about you. And who should be caring about you? You should be caring about yourself, your future, the future of your own health, your legacy with your family, your kids, your grandkids. Nobody ain't thinking about you. Everybody's worried about their bottom line. CMS, who's going to get more money, which patients get readmitted. The patients that get readmitted, we see them back and forth in the hospital, the same ones over and over and over again. And typically it's not from, they were not, they weren't compliant. I don't believe that. A lot of times they may have taken too many meds, or, it could be multiple things, a mental issue. Who knows? I hated that word, non-compliance. But who really cares about us nurses? If we don't care about ourselves, nobody's going to care more about you than you caring about yourself. And I've had many jobs in my career, and for the most part, I've had wonderful employers. But that's just it. They were employers of another employer. And at the end of the day, the hospital is worried about their bottom line, which they should be. But they're not concerned about what's going on. Do you have time for your family? Do you have a work-life balance? Are you so stressed out that you have to go to a therapist or psychiatrist because you have anxiety from just walking into your job? I'm going to do an upload on when it's time to say goodbye. At what point do you just say, okay, I have to quit. I need to quit this job, or I need to find another one. At what point do we say that? And a lot of people don't like to, talk about this. And I'm going to keep it 100 with our nurses. I'm going to do another segment about really what's really going on in nursing. Because we're really not talking about this stuff here. Okay, everybody talks this as being a wonderful profession, and it is. It has helped me feed myself. But there's some unknowns to this profession that nobody really talks about. Now, I mentioned one of them being nurses eating their young. What other profession do you know where they talk about eating their young? What kind of mess is that? Just the psyche of that whole situation. It's like you're going into the lion's den, the lioness's den, because most nurses were mostly a female-oriented profession. What kind of mess is that? Why would you not want to help your fellow nurse? Who does that? And I don't hear about that in any other profession. But then you have to think, if you're going into a profession like that, what kind of stress are these nurses really under? Everybody touts it as being a wonderful profession. But when I talk to nurses on a serious tip, y'all, a lot of these nurses are unhappy with their jobs. They know they have some kind of quote unquote security because they always short of nurses. Because guess what? They short of nurses because ain't nobody trying to bust their head open to the white meat to get a nursing license and then be abused when they get on the daggone job. Nobody ain't running into abuse. Nobody wants that. So we probably will always have some job security to a certain degree until they get a robot to do our jobs. That's stories for other days. We could talk about that too, because they're trying to automate everything, and anything. Okay, all right. But again, I'm always going to encourage my nurses. Think about yourself. What is it? How much talent that we have that we can multitask in a hospital and just use all of our senses to really help people. Why can't we do that for ourselves in our own businesses? We are all talented, and I know, and I'm a believer, we are wonderfully made. And for those who are not believers, still listen. Don't worry about it. You're wonderfully made too. You know what I'm saying? If you were a nurse, look, we could do anything. Okay? And that's my belief. When you are a registered nurse and you pass those state boards, I truly believe you can do anything. So that's why I'm bringing you the T, the 411, and keeping y'all abreast of what's going on in these hospitals, because ain't nobody telling y'all. I want y'all to get the viewpoint of what's really happening so you guys can make a decision. Do I want somebody else in control of my destiny in life, or do I want to have a say in it too? Okay? So, hey, thank you so much for listening. Please like and subscribe. Thank you so much to all my new subscribers. I'm going to continue to try to be consistent to bring you guys new content, information, good, bad, indifferent. But I'm going to always be here to encourage you to say, look, you can do this. You can work from home. You can start your own business. You can do whatever it is you need to do if you're a nurse, even if you're not a nurse. And thank y'all so much for subscribing. Hit that like button. I will see you guys on the next upload of the Nursing Chronicles with Monique. Peace.